everyone. My name is Matthew Kurian. I am a medical oncologist at St. Elizabeth's Healthcare in Edgewood, Kentucky. I'm here to discuss some of the most interesting abstracts that are to come for San Antonio this incoming year that have caught my eye, and we'll talk about three of my top three abstracts to watch for at San Antonio Breast Cancer Symposium 2025. So the first trial is the HER2CLIMB-05 study. This is a phase 3 trial that looks at adding tucatinib in addition to trastuzumab and pertuzumab versus our standard HP alone as a maintenance strategy after 4 to 8 cycles of first-line THP in the metastatic HER2 positive setting. And so we had seen a press release from this and anticipate the results to be presented at San Antonio that showed that it did have a clinically meaningful progression-free survival improvement with the addition of tucatinib plus Herceptin and Perjeta as well too versus HP alone. And we look forward to those results. I think it comes at a very interesting time, I think, in the setting of the Destiny Breast 5, 9, and 11 studies, just hot off the press, this past year. And it is changing our thoughts about the use of TDXD in different settings. This trial was conducted at a time prior to these trials as well, too. So it'll be interesting to me to see how people view this maintenance strategy, in the future and in the current landscape of things as well, too, when we have that data, and also in the setting of the patina data for our hormone positive, HER2 positive patients as well, too. So I think this will be an excellent option. I think we've not had a great maintenance strategy for individuals despite having HP. There are still individuals that have brain metastases as well too, and this is where tucatinib can really shine based on the earlier HER2CLIMB studies in the metastatic setting. So I think all of us are very hopeful that we see that the use of tucatinib may potentially help decrease, the number of brain metastases we're seeing in that maintenance setting. So that was a very interesting one as well too. The next study that I think is drawing a lot of attention is the lidERA trial. This is a study that the largest adjuvant SERD study ever conducted with more than 4,000 patients that looked at the drug giredestrant, an oral SERD versus physician's choice endocrine therapy, whether that be aromatase inhibitor or tamoxifen plus LNRH agonist as well too, in the medium to high risk early hormone positive HER2 negative breast cancer setting. We also saw a positive press release from this showing that it didn't meet its primary endpoint in invasive disease-free survival versus standard endocrine therapy. And this is really the first, adjuvant SERD to really show superiority over current endocrine therapy. Overall survival was trending positive but immature. So this is a very groundbreaking study in the sense of that, we've used tamoxifen and Arimidex and others for, 20 plus years. And so, shifting the needle into something that could be more effective in preventing recurrences, is excellent. And I think that, this opens the door to potentially, adjuvant studies with the use of CDK4/6 inhibitors. I think it also muddies the water a little bit of whether we should be using oral SERDs alone versus in combination or not. So I think this is a huge paradigm shift for our field in the hormone positive space as well too. And then the last study that I think is drawing a lot of attention is the ASCENTO-7 study, which was a phase 3 trial for hormone positive, HER2 negative metastatic breast cancer patients who had progressed on endocrine therapy and who are candidates for first line chemotherapy. And we saw a press release that the primary endpoint was not met, and the sacituzumab govitecan did not improve progression-free survival over physician's choice chemotherapy. Overall survival was immature, but trending, in that direction, favoring sacituzumab. This, I think, is one that I think a lot of us really want to understand exactly, what was the signal and how much of a difference there was between the two arms as well, too. If you remember, the TROPiCS-02 study was what initially got sacituzumab its initial approval in the hormone positive setting. I think obviously for those that are HER2 low or ultra low, I think a lot of us still favor TDXD in that setting as well too. But for someone that is truly HER2 zero, this is what a lot of folks would be leaning towards based on the TROPiCS-02. But I will call it attention that this trial was a very different design. The TROPiCS-02 was a very heavily pretreated population of patients that may have had, other lines of chemotherapy as well, too, in addition to endocrine therapies. Whereas this one, the Ascento-7 study looked at a group of individuals that have had progressed on at least two or more previous lines of endocrine therapy, and then maybe been a higher risk population that maybe progressed on first line endocrine therapy within 6 months, or even adjuvant as well too. And they had to have no prior ADCs as well too. So I think this is a very different patient population. I think there will be a lot of focus in terms of the safety signals and whether or not individuals got prophylactic GCSF or not, and whether that has any effect, on what we're seeing as well too. But I think that is another study that I think that it reinforces the point of timing of these ADCs is quite important into trying to understand exactly, in a more heavily pretreated patient population versus someone that is newly endocrine resistant as well too. The timing of our ADCs is quite important as well too. So I look forward to seeing all three of those abstracts presented as well too, and seeing more of all the excellent work that is coming at San Antonio this year.